Chantay Moye. I live in Washington, D.C. with my husband and my 8-year-old daughter, Kennedy. My friends would describe me as the life of the party, but very serious about my causes, very serious about my career, but very, very fun-loving. I was well into my 30s when my periods became very heavy. I was about 35. Once I had my daughter, the heavy periods resumed immediately, nonstop. I was thrown off course. I had cycles once or twice a month, and it was full on. It was the heavy maxis, the maximum that you could have. It was changing, once or twice an hour, so that's a lot. That's a lot of bleeding. I had a lot of procedures that were related to the heavy bleeding. I think I did the depot shot. I did 2 types of IUDs that did not work. Both came out on their own, actually. So again, that was, I think, 4 or 5 things that we tried that just didn't work. And so one day, the OB said, you know what? We have a new procedure. We've been looking at all of the data that's coming out of the studies, and we really feel like you'd be a good candidate for this procedure. Take this brochure home, look it over. My husband was with me. You guys look it over, figure out, if you have any questions, call me. When the physician told me about NovaSure, I actually loved the conversation. It was an open, gentle, honest conversation. It was let me sit down and explain to you what this is. It wasn't, I'm going to sell you this. It was, let me tell you all about it. And so we went through X, Y, and Z. Here's what you can expect. Here's what you can expect with the procedure. Here's why I think it's great for you. The day of my procedure for the NovaSure, everything was seamless. It was quick, it was a 10-minute comforting conversation. And then, I was out, and maybe, 30 minutes later, I was okay, and it was done and everything went well. I did not get a next first period after I had the NovaSure. It was a feeling of relief. It was a feeling of just knowing that, okay, we have this fixed, that's behind me, let's move on to something else. The advice that I give to women that talk to me about heavy periods is that I always open up about NovaSure, what it did for me, how easy the procedure was, how, quick it was, how, it worked instantly, it worked immediately. I also always talk about the possible side effects or the possible bleeding. I would 100% recommend NovaSure to someone that is a very good candidate for it. The NovaSure is the best thing that's ever happened to me in my life, besides my daughter and my husband. But yes, I love the NovaSure.
Pivotal study information. In a pivotal study, 175 women receiving the NovaSure procedure showed a 1-year success rate of 77.7% and 1-year amenorrhea rate of 36%. Patient success was based on a reduction in a menstrual diary score indicating menorrhagia pre-treatment to a diary score indicating normal to no menstrual bleeding at 1 year post-treatment using a validated scoring system. The NovaSure procedure is not for those who have or suspect uterine cancer, have an active genital, urinary, or pelvic infection, or an IUD. NovaSure endometrial ablation is not a sterilization procedure. Rare but serious risks include, but are not limited to, thermal injury, perforation, and infection. Temporary side effects may include cramping, nausea, vomiting, discharge, and spotting. Important safety information. NovaSure endometrial ablation is for premenopausal women with heavy periods due to benign causes who are finished childbearing. Pregnancy following the NovaSure procedure can be dangerous. The NovaSure procedure is not for those who have or suspect uterine cancer, have an active genital, urinary, or pelvic infection, or an IUD. NovaSure endometrial ablation is not a sterilization procedure. Rare but serious risks include, but are not limited to, thermal injury, perforation, and infection. Temporary side effects may include cramping, nausea, vomiting, discharge, and spotting. Inform patients to contact you if they experience a possible side effect related to use of this product. For detailed benefit and risk information, please consult the IFU.